Welcome all of you for the discussion of high yield and expected questions for INISET and NEET PG. Now the question reads here, which part of the intestine is dilated on the given radiograph? So the options are transverse colon, ileum, jejunum and duodenum. What is the right answer? The answer is jejunum. These are the prominent folds of jejunum. They are called volvulae convergentes. They are called volvulae convergentes. Now, what we should understand here, the dilatation of small bowel, dilatation of large bowel, and how it appears. Now, they will ask you this question. The question is, how many air fluid levels are required to state it could be an intestinal obstruction? Anything more than 2 is abnormal. Anything more than 2 is abnormal, and the two normal inconstant air fluid levels, one is the duodenal cap, other is at the ileocecal junction. Anything more than that could suggest you of intestinal obstruction. All obstruction is called step ladder pattern. It is called step ladder pattern. Large intestinal obstructions will be usually periphery, will be placed periphery, where the small intestinal obstruction usually will be centrally located. And as it is peripherally located, you will see a prominent hostrations. Prominent hostrations. Understand? What are the causes? Childhood causes of small intestinal obstruction. One of the most common cause is intestinal atresia. The most common intestinal atresia is duodenal atresia. In duodenal atresia is more commonly associated with endocardial cushion defects, Down syndrome, and also classically see double bubble appearance. Double bubble appearance is a duodenal atresia. And the treatment of choice is duodenostomy. An important differential diagnosis of duodenal atresia is annular pancreas. And the treatment of choice for annular pancreas is again duodenostomy. Now next comes the jejunal atresia. And jejunal atresia can cause dilatation beyond the site of obstruction or proximal to the site of obstruction and with prominent mucosal folds. And jejunal atresia and obstruction prominent to the atresia will typically give you triple bubble sign. It is called triple bubble sign. And whenever you see in a duodenal atresia, the distension will be less. Jejunal atresia will be mild distension, and ileal atresia will have prominent abdominal distension. Understood? So this is to do with jejunum, ileum, and duodenum. And transverse colon, the dilatation of transverse colon, and any dilatation beyond 7 centimeters is called megacolon, and any distal obstruction like CA rectum or volvulus can cause dilatation of splenic flexure, transverse colon, hepatic flexure, and ascending colon, and cecum. The most common site of rupture in a closed loop obstruction in large intestine is anterior cecal wall. Is the anterior cecal wall. So these are some of the most important MCQs that could be asked in an entrance exam. And also toxic megacolon. Toxic megacolon is more commonly seen with ulcerative colitis. It can also be seen in Crohn's disease. Most commonly seen with ulcerative colitis. The other important aspects of intestinal obstruction, the most common cause of intestinal obstruction is adhesion. In adults, they ask you, the most common cause of intestinal obstruction adults is adhesion, post-operative adhesion. And it is 40%. It is almost 40%. Comes the inflammatory pathology and malignancy or cancer. It is 15% each. Then hernia comes almost 12%. Then it could be the intestinal pseudo obstruction of Ogilvy's and fecal impaction of say 8% and miscellaneous another 5%. So these are the causes of intestinal obstruction in adults. And in children, we discussed about intestinal malrotation. It would be duodenal atresia or jejunal atresia, or it could be ileal atresia. Understood? So these are the possible number of questions that could be asked in a radiograph like this. So once again, I wish you all the best, and also join Speed Learning app to learn important concepts and facts. We have an excellent set of faculties, and definitely they will teach you in a way that you could really love the subject and be made easy for you. And I request and wish all of you could join Speed Learning app for preparation of PG entrance examination. This is going to be INISET, NEET, or next. I'll see you with more questions tomorrow. Thank you very much. Bye-bye.
Best training, peaceful environment, PG medical entrance exam preparation were my expectations. I got them at Speed Medical Village in Kanchipuram. Today, I am a PG topper.
Speed Medical Village, a unique eco-friendly campus dedicated for PG preparation. Speed Medical Institute, a complete solution for medical education.